Today's senior leaders in Africa are facing a lot of challenges when it comes to decision making and implementation of policies and programs. Today's leader has to think about a raft of so many challenges and so many scenarios happening at the global level, regional level, and of course at the country level. So the Advanced Healthcare Management Program is targeting senior leaders in the health sector who are either at national level or regional level, to give them the tools and the expertise to be able to be very effective leaders in shaping and strengthening the healthcare systems of the various countries.
The Advanced Healthcare Management Program was very beneficial for me. First and foremost, it bridged my knowledge gap, considering I was transitioning from a different industry.
I like that we tackled shareholders, stakeholders, people, organizations. I like that it was a mix of both the government sector and the private sector.
The kind of the people I've interacted with here, both from the private sector, have opened my eyes on an angle that we haven't been able to look at on healthcare management. On the private side, we realized that these people have performance indicators that they're able to meet, which is an adoption that I would welcome into the public sector, so that we can be able to be efficient in the delivery of services that we are able to do, and also make sure that we are achieving the goals of UHC as we move forward.
I remember immediately after one of the practical sessions we had in class around operational efficiency, where we were given a case scenario of a factory where you are manufacturing products, and we were trying to see where do you get bottlenecks, where do you find inefficiencies, and how do you go around it within a team. And the lessons I learned from that, I took it immediately to my hospital back in Kisii. And I started looking at the operational efficiencies. Where are we getting traffic snarl-ups? What can we do? I want to give a case in point. I was able to apply that by devolving billing points. Okay? Instead of having one centralized billing point, we're able to have multiple billing points, and we saw amazing turnaround in terms of waiting time for our patients, in terms of discharge, getting services, and revenue generation. I saw an immediate rise in terms of the revenue collections.
This program met my expectations because it gave me a platform to interact with different players in the industry. It gave me opportunity to interact at very close level and share experiences with other people.
For me, it really equipped me with the right skills on how to manage effectively, and also the resources given to me, how to manage them efficiently.
I feel I got value for my money, my time, my sacrifice. It has made me a better person from day one.
It also helped broaden my knowledge because of the international experience. I was able to get perspective of different healthcare systems, different financing models that have worked in India specifically, which can be adopted. It also gave me the opportunity to see where I can plug in terms of supporting the government sector with some of the wins that we have already made in the private healthcare side.
During the international module, one of the things that we did was visit India. India, of course, we know is a middle to upper middle income country that has gone through the steps that we have, that is also in the process of rolling out a massively ambitious universal health coverage agenda. But also they are at the forefront of pharmaceutical development, medical devices development, and of course we know that there's a huge number of Kenyans who go there for advanced healthcare. And so we gave our students an opportunity to experience all this, both at the private sector perspective, visiting factories, visiting medical device companies, but at the same time also visiting their leading private institutions, hospitals, as well as government bodies.
am a research scientist who's overseeing the biotechnology research program at Cambridge. So I looked at it and I realized that for me to be able to bring positive change in healthcare, I need to do a project that actually interlinks Cambridge, interlinks the Ministry of Health, but also brings on board the doctors and other researchers, even the people who deal with data. So my project is on precision medicine. The idea was already there, but there was the fear, there was the component of really not pushing myself to doing it. But the program was a pusher because it showcased that I shouldn't wait for someone else to do it or for someone else to now say, oh, let's move it. So I moved this program from concept to implementation courtesy of the program.
For me, my project was breaking down the balance scorecard to look at what is your daily deliverable, what is your weekly deliverable, what is your monthly deliverable. And we're not focusing on only the big picture, but we are meeting the small deliverables that bring the big picture to life.
So my project for this particular program was designing a costing model for surgical services at our hospital.
My project is more or less of a proof of concept, which involves what we are doing currently with the UHC program within the ministry, which involves the community health promoters on how we can be able to utilize them and also get more CHPs from the community to be able to be on board, while also reducing the physical expenditure by the ministry to the community.
My project was around execution because I do know that's where things do go wrong. You have a good strategy, but unless the planning and execution is done very well, that's where the failure happens. So I had the opportunity to set very clear objectives on how to drive execution culture from the leadership team to the layer below us.
I would recommend this advanced healthcare program to other leaders because it provides a lot of insight in the policy world. It provides a lot of insight in stakeholder management.
A strong focus on leadership and governance, different financing models, and most importantly, the cross-learning with peers like yourself. So indeed, I would recommend it.
How I wish it can be availed to everybody in the healthcare sector, from the top down.